Hello everyone. Are you going to be a mother soon? Are you planning to expand your family in the future? Does the thought of abnormal pregnancy disturb you sometime? Before I begin, let me tell you that such a thought is absolutely fine. It's absolutely okay. In my years of experience, 3 out of 10 pregnant women express this concern, express this thought, and let me assure you that this is absolutely okay. I can totally relate to the concern that comes to your mind. Allow me to share 7 different reasons that you should know if there is a possibility of having an abnormal pregnancy. What does the statistics say? For any woman who is pregnant, there is always a small risk of carrying birth defect or abnormal pregnancy, and this is around 2 to 3% worldwide, even in a healthy, normal, well-built women. But this risk might increase in various situations. What are they? Number 1 is age at conception for the women. We do down screening for all women across all ages during pregnancy. What does the data say? Woman, if she plans to get pregnant at age 25, the risk of carrying Down syndrome is 1 in 1300. The same risk increases if the woman plans to have baby at age 40, that is 1 in 100, and this again increases to 1 in 30 if a woman is conceiving at age 45 with her own eggs. One more thing is, if a woman has had her previous baby with Downs, then her chance of having a Downs baby in future pregnancy is also high. Most Downs baby deliver in women less than 35 years of age. Why is this so? This is because women under the age 35 have more babies compared to women older than 35 years of age. You don't have to worry about this because there are prenatal testing available to determine or diagnose these chromosomal abnormalities and birth defect. And how they can be done? They can be done using blood tests and scans. If there is a high index of suspicion, then we have invasive tests also available. Majority of the abnormality or the birth defect can be picked up during scans and these blood tests. Number 2 is the nutritional deficiencies or the nutritional status of a woman. I'm sure you'll agree with me that poor diet lacks key nutrients. Did you know that women who are deficient in folic acid have a higher chance of birth defects related to brain and backbone, and this group of birth defect is called as neural tube defect. This particular defect can be completely eliminated by giving folic acid administration for all the women who are planning for pregnancy. Also, if a woman is deficient in other key nutrients such as minerals, vitamins, micronutrients, she may have problems related to baby's growth, baby not growing well, low birth weight, or mother having anemia or blood pressure during pregnancy. All this can be eliminated by proper diet. So now do you realize how important diet is for the baby's overall development and also a smooth journey that mother can have during her pregnancyhood? Number 3 is if woman has associated other medical conditions. For example, diabetes. If a mother is diabetic, she stands 3 times high risk of having birth defects during pregnancy compared to those women who are not diabetic. If the sugars are not under control, especially during the first trimester, around 5th, 6th week of pregnancy, then it can severely impact the baby's development because all the organs are getting formed around this time. This affects the baby's brain development, heart development, kidney, ears, eyes, intestine, and so on. But good thing is, if a woman knows she is diabetic, then she must first ensure that her sugars are under very good control before she starts the journey of conception. If the sugars are kept under very good control, then all this risk can be completely eliminated. Number 2 is thyroid related issues. If mother is hypothyroid, she has less of thyroid hormone, then this can also have an impact on the baby's development, especially the brain development. Thyroid is an essential hormone required for the brain development, motor development, and mental development of the baby. If this remains uncorrected and baby delivers, baby might have also low IQ after delivery. All this can be averted by giving simple thyroid tablet. So make sure that you test the thyroid even before you start the journey of conception. If it is abnormal, then you are given a replacement therapy, and the correction itself will eliminate all the developmental issues that a baby might have because of the deficiency. Number 3 is the epilepsy. Epilepsy is also called as fits in a layman's term, and for controlling this, women are given medication. The woman may be on a single drug therapy or 2 or more drug therapy. If a woman is on more than 2 drug therapy, then these medications are associated with various birth defect problem, especially related to the facial defects, brain defects, heart related abnormality, skeletal and limb abnormality. Chances are also high if woman is on such medication. So when a woman plans for pregnancy, it has to be planned properly in collaboration with the neurophysician, and the aim will be to put the woman on least medication as possible. If woman is taking only single drug treatment for controlling the epilepsy, then her chance of having any type of birth defect actually will be very less. If you have any addiction such as alcohol use or smoking, then this can also impact the development of the baby. Alcohol use in the first 3 months of pregnancy can have an impact on the baby's facial development. It also affects the overall growth development and also the brain development with any kind of use of alcohol during pregnancy. So it is better that a woman contemplating pregnancy avoids use of alcohol completely. Another addiction is smoking. Smoking also has an injurious effect on the cellular health. It can cause tissue damage to the unborn baby, particularly the lung and the brain. There are some studies that says that there is a link between smoking history in the mother with the development of the cleft lip, that is a abnormality related to the lip development of the unborn baby. So it is good and wise to quit smoking when a woman is planning for bringing a new life into her world. Infection could be another reason of abnormal pregnancies. Which are those infections that can increase the risk of birth defect during pregnancy? I will not go into the medical details, but I'll just give you the gist of it. Any infections acquired during pregnancy, such as bacterial, viral or parasitic, are generally associated with adverse pregnancy and birth outcome, and the outcome can be varied. It could be miscarriage, pregnancy loss, developmental abnormality, severe birth defect of brain and heart. Post delivery, it could be hearing loss or vision loss. Now, which are those infections? To name a few, it could be toxoplasmosis, herpes, cytomegalovirus, rubella, listeriosis, syphilis, and there are many more. Are they completely preventable? Only rubella is completely preventable. Every woman who is planning for a pregnancy should get blood test done for rubella antibodies. If she is negative for those antibodies, then she should get vaccinated with the rubella vaccine. What are the other precautions you are supposed to take to avoid infections during pregnancy? Ensure that you take all the vaccination that are offered to you during pregnancy. Thoroughly wash your hand with soap and water, especially after use of toilet, after changing of diapers or nappy, before cooking meals, before eating or drinking. Avoid people who are unwell. Avoid sharing your food with young children. Avoid kissing them on their face. Avoid touching the cat's litter if you own one. Make sure that the food is cooked properly, especially the meat and fish. For any more queries regarding this, please consult your doctor. If as a couple you are related to each other, if you are married to somebody very close in your family, if you are married to a first cousin, then the chances of having genetic abnormality might be definitely a little more compared to those couple who are not related to each other. The best thing is to understand about what risks you might get by talking to a genetic expert and have a genetic counseling with a geneticist. Then if you or your partner is a carrier of some disease, or if there are some diseases that run in the family, for example, if you are a carrier of thalassemia, sickle cell anemia, or there are some diseases that runs in the family such as spinal muscular atrophy, Duchenne muscular dystrophy. If such a history is found, then you should bring this to the doctor's notice and you will be guided to the geneticist, where you will have a proper genetic counseling and assessment, and this can be tackled by carrying out IVF with PGTA testing. While these are the factors that can impact the chance of having an abnormal pregnancy, and you can now understand that having the right knowledge and support, you can take control of all these factors. While these are the different factors that might influence the chances of abnormal pregnancy, it is important that you approach it with the right knowledge and support. Take the next step towards a healthy and a happy pregnancy. book an appointment for having a preconception counseling. I know these days many of them want to have either one baby or two baby. Then it is definitely important that you plan it properly, have a consultation before you start the journey of conception with a doctor, understand these factors, take control of it, and then begin your journey to conception.